The Japanese medical system is characterized by the fact that all citizens are required to enroll in the public medical insurance system, and foreigners who stay in Japan for more than 3 months can also enroll in this public medical insurance system, with subscribers paying only 30% of their medical expenses and 70% subsidized by the government. In the case of private insurance, the full amount of medical expenses must be paid at the time of consultation and will be billed to the insurance company at a later date, so it is important to confirm this in advance. Preparation for medical examination. The following documents are required at the time of medical examination. Insurance card. If you have insurance in Japan, be sure to bring it with you. If you forget to bring your insurance card, you will be asked to pay the full amount, which will be refunded at a later date. Identification, residence card or passport. Cash or credit card. Some hospitals do not accept credit cards, so be sure to bring cash as well. Regarding the acceptance of foreign patients, Japan is making progress in improving multilingual support. The Ministry of Health, Labor and Welfare (MHLW) and the Japan Tourism Agency have collaborated to provide a nationwide list of medical facilities with foreign language capabilities, and multilingual interpretation and translation applications are available to assist. In addition, the International Medical Information Center (AMDA) provides telephone support in several languages, including English, Chinese, and Korean, and can guide you to the medical facilities you need. This section explains the procedures for foreigners residing in Japan to enroll in public insurance. Enrollment in public medical insurance is mandatory for foreigners staying in Japan for more than 3 months, but the process varies depending on your status of residence and place of employment. Enrollment in National Health Insurance (NHI). National Health Insurance (NHI) applies to foreigners who do not work for a company, are self-employed, or are students. Enrollment procedures are carried out at the municipal office of the city, ward, town or village where you live, and the following documents are required. Residence card required to confirm your status of residence. Passport presented as an identification document. Residence card if it is proven that you have lived in Japan for more than 3 months, you are eligible for enrollment. After the procedure, a national health insurance card will be issued, and you can receive medical treatment at 30% of the medical cost. At the municipal office, insurance premiums are calculated based on the resident tax and income of the municipality in which you enrolled. And if your annual income is low, you may be eligible for a reduction or exemption of premiums. In addition, all foreign nationals with family members are individually enrolled in the system, and medical expenses for family members are also covered. Social insurance, health insurance, and employees' pension. Foreign nationals employed by a company are required to enroll in social insurance, health insurance, and employees' pension. In general, foreigners who work more than 20 hours per week and on a contract of 1 year or more are covered by this insurance. The procedure is handled by the employer, and the premiums are deducted from the salary. If you join the company's health insurance program, you do not need national health insurance. Foreign nationals with a medical stay visa come to Japan for the purpose of long-term medical treatment and are therefore not covered by the general health insurance system. Those staying in Japan on a special activity visa may also not be covered by the national health insurance, so it is recommended that they purchase a private overseas travel insurance policy or other insurance in advance. Specialized medical interpreters and interpretation. Applications are available at medical institutions in Japan to resolve communication difficulties caused by language. Professional interpreters are recommended over family or friends, especially in situations where it is difficult to understand medical terminology. Some hospitals have well-developed medical interpretation systems that take into consideration the cultural background of the patient. In Japan, a medical stay visa is offered to foreigners for the purpose of medical treatment. This visa is issued to foreigners who wish to receive long-term medical treatment or physical checkups. and allows for the stay of family members or other attendants. To apply for a visa for medical stay, the applicant must obtain approval from a Japanese medical institution, and the period of stay can be flexibly adjusted according to the treatment. Japanese medical care is highly regarded for its quick response to emergencies, clean environment, and accuracy of medical treatment. In addition, appointment systems are well developed, and some hospitals provide email notification and confirmation prior to consultation. In Japan, examination and treatment are consistently performed based on the doctor's diagnosis, whereas in many other countries, consultation is usually based on one's own judgment. Advance reservations. Many medical facilities accept reservations, and making an appointment can reduce waiting time. Use of medical questionnaires at Japanese hospitals. You will be asked to fill out a medical questionnaire prior to consultation. If you are not comfortable with language, it is helpful to write down your symptoms in advance. Confirmation of costs. Since costs vary depending on the nature of the treatment, confirming an estimated amount in advance can reduce financial concerns. The Ministry of Health, Labor and Welfare and local governments provide training for medical staff and promote multicultural conviviality, so that foreign residents can receive medical care in Japan with peace of mind. In particular, training of medical coordinators for receiving foreign patients is underway to improve the support system in the medical field. In Japan, the public medical insurance system covers 30% of the cost of medical care in principle. There is also a high-cost medical care reimbursement system in place that allows patients to avoid paying additional costs if they exceed a certain limit. For example, the cost of appendicitis surgery and hospitalization is estimated to be about 310,000 yen in Japan. But this is the co-payment after insurance coverage, which could reach about 600,000 yen if the patient is uninsured. In the United States, the insurance system is not publicly maintained, and reliance on private insurance is common. Hospitalization costs for appendicitis can range from approximately 599,000 yen, about 40,000 United States dollars, to 816,000 yen, about 55,000 United States dollars without insurance or with a high-cost plan. And in some cases, the full cost of treatment must be paid. In addition, the out-of-pocket costs are extremely high, with the initial consultation alone costing 150 to 300 United States dollars, approximately 20,000 to 30,000 Japanese yen. The NHS National Health Service in the United Kingdom is funded by taxes, and medical care is basically free. However, there is some co-payment for prescription drugs. It has also been noted that waiting times at public medical facilities are long, with patients sometimes waiting several weeks for an initial consultation, and even several months to see a specialist. France has adopted the same universal health insurance system as Japan, and the co-payment rate is generally 30% for outpatients and 20% for inpatients. In some cases, the co-payment is 50% without a letter of referral. The cost of appendicitis surgery is approximately 1,080,000 yen, which is slightly higher than in Japan. Japan is internationally recognized for its free access system, which allows patients to receive medical care at any medical institution with a single insurance card, and for its low-cost burden. The OECD reports that per capita medical care costs in Japan are $4,630, about 500,000 yen, which is significantly lower than the US per capita cost of $10,000, about 1.1 million yen. This is significantly lower than the US per capita cost of $10,000, approximately 1.1 million yen. Furthermore, the high-cost medical care reimbursement system makes it possible to reduce out-of-pocket expenses even for expensive treatments. Japan has one of the highest levels of hospital beds and medical equipment coverage among developed countries. The number of acute care beds per 1,000 people in Japan is well above the OECD average. And the country is also characterized by an extremely high penetration rate of CT and MRI, as well as a full range of diagnostic equipment. This makes it easy for patients to receive highly accurate examinations and treatment. But there is also a shortage of physicians. According to OECD data and Numbio's Healthcare Index, Japan also scores highly in medical technology and quality of services. In particular, Japan's low infant mortality rate and high average life expectancy are considered to be the result of preventive medicine and high-quality care. And Japan ranks high in international health indices. On the other hand, the length of hospital stays is also a characteristic of Japan, which means that the environment is conducive to long-term treatment for chronic diseases and rehabilitation. But this differs from the international trend in many countries, where short-term intensive medical care is the main focus. Japan's standard of medical care is internationally recognized, especially in advanced and highly specialized therapeutic areas such as cancer treatment and cardiovascular care. But the aging of the population has necessitated a response to rising medical costs. If you found this video useful, please subscribe to our channel and give us a high rating. Thank you for watching.